from generation to generation. So just because it runs in families, which it does seem to, doesn't mean that it's genetic. Were they born with it? Some of the findings suggest that there's no way to explain handedness, and it's a little difficult to explain overall height without going back to prenatal biology. We don't know what it is, and we don't even know if it's necessarily destiny before birth. All we really know, is that the brain was different before birth. We got this basically from handedness, is what said, whatever the chain of events is, the chain begins before birth. There's an old famous saying in brain development. The earlier you catch it, the harder it well, hate when bad things happen to good sentences. Early in a disease, the harder it is to detect, but the easier it is to treat. Later in development, the easier it is to detect, but the harder it is to treat. So if we can find whatever is going on at the beginning of the chain, the beginning of the chain might just be general vulnerability. It might not be specifically pedophilia, and we're just finding somebody with a brain that's trying to compensate for something that went wrong. Maybe it was the mother was exposed to some virus while she was pregnant. Perhaps it was poor prenatal care, vitamin deficiencies, poor nutrition. Any of those things could develop a vulnerable brain, and then something else in addition happens over the course of life to put the person on a course towards pedophilia. So we don't yet know how the whole pipeline works, but the pipe begins, apparently, in the womb. So are they responsible for it? Again, we have to make our division between pedophilia and child molestation. They don't seem to be responsible for what they're attracted